is an interview with Dr. George Meinig from Ojai, California, on root canals and the history of the research into the dangers of root canals. Dr. Meinig.
Thank you. Things I'm going to tell you make it necessary for me to give you a little of my background, because you're not going to quite believe with my background that I'm talking about the things that we will be mentioning to you about how teeth are very often always infected, and particularly when they've had root canal treatment. And so as to my background, I was very fortunate as a dental student to be in the school in which Dr. Edgar Coolidge, the foremost research specialist in the world on root canal therapy, was our professor. I ended up, after I was out of school in the first year, having him ask me, along with 5 other dentists from our school, to be members of his study group. And as such, he gave us postgraduate training in root canal therapy. Mind you, this was at a time when there wasn't even a school teaching root canal therapy. It was just a professor or a teacher who was involved in these different schools, and not all schools had a department in root canal therapy who were doing these things. At any rate, I had that background with him, and could have gone into root canal therapy as a specialist, but I didn't want to give up the other things in dentistry, so I continued doing both. As an outgrowth of that, I was one of 19 dentists that got together and started the Root Canal Association. And this was back in 1943, if I remember the year correctly. And since then, it has grown from the 19 of us, to the fact that they now have 5,000 members who are members of the Root Canal Association. It is now called the American Association of Endodontics. Trevor has asked me to mention some things that are involved about this whole business of root canal filled teeth. And this didn't start out because of root canal filled teeth. It started out because of infections that occur in teeth. And really most of this deals back to the early 1900s, when Frank Billings introduced the focal infection theory in 1904. And that focal infection theory merely meant that if you had an infection somewhere in the body and the bacteria that were transferred from that infected area to another gland, tissue, or organ, that this would then set up a whole new infection. And these could lead to other types of disease and so on. Well, what they discovered mostly around World War I days, but it started out in the early 1900s, so was the fact that they found teeth that have had root canals always remained infected, no matter how good they looked or how good they felt. And so the question that you would like to know is, what happened that made that so? And unfortunately, the 3 scientists who did the vast majority of research on this subject, there were many more than the 3, but those 3 were Frank Billings, who introduced the focal infection theory. Secondly was E.C. Rosenau, who was the world's premier bacteriologist at the time, and the other was Weston Price, a dentist who was a specialist in dental research. And he had been doing a lot of dental research, but what we didn't learn immediately, because the 2 books that he had documented his research about dental focal infections was all buried in the archives of the foundation that has his research data. And we didn't learn about that until 1993. And so, but nevertheless, he was doing all of this research from 1900 on through into the 30s. And so what he found were a number of interesting things. And one of the most interesting ones was that he had a patient in which he did a root canal for, who was a woman who did sewing of various fancy kinds of things for Marshall Fields in Chicago and for other wealthy people and so on. And what he did, he found that he had done a root canal for this woman, and she developed a severe arthritis in her hands, in her ankles, and her wrists, and her elbows, and she became so crippled with arthritis from this infection that she was bedridden most of the time, could get around only with crutches and a wheelchair and that sort of thing. What happened here was that Price had learned from Frank Billings, Dr. Billings, and Dr. Rosenau that these focal infections infected teeth very severely, and that this could be a problem that's causing numbers of different kinds of degenerative diseases. And so what he did, he finally convinced this woman that she should let him remove this root canal filled tooth that he had done for her, even though it looked very fine on x-ray and she had no symptoms of any kind from the tooth, and of course didn't want to lose the tooth. He said he thought that there were some things there that they could show that would prove that her joint swellings in her hands and ankles and so on were due to this infection from that tooth, even though it looked all right. And so she finally consented, and one morning he removed that tooth for her, and after he sent her on her way for the day, he then took that extracted tooth, and he had secured a laboratory animal. In this case it was a rabbit, and he made he took this rabbit and he made an incision in the back of the neck of the rabbit, just a small incision here, and he took that extracted tooth and he implanted it in that incision area in the back of the neck, and he put a couple of stitches in so the tooth wouldn't fall out, and he put the rabbit back in its spacious cage that had plenty of good food and water, and awaited developments. Well, it didn't take very long. In just 3 days' time, that rabbit developed the same swelling in its limbs, as you can see here, that the patient had in her wrists and ankles and hips and so on. And so, and along with that happened in 3 days, and 10 days later, that rabbit passed away because of the infection that was in the tooth. Well, interestingly enough, with the passing of the rabbit, the infection in her wrists and ankles and hands and so on began to disappear, and within a couple of months she was up walking again and getting along quite well. Now, when people heard about Price's implanting teeth under the skin of an animal and then having that animal get the various diseases that the patient may have had, they said, oh, well, you implant any tooth under the skin of an animal and it will cause them to be sick and die. Well, to prove that wasn't so, Price took a number of teeth that were normally healthy teeth, These were teeth that were removed for orthodontic purposes, teeth that were impacted teeth that weren't infected in any way, and he would implant those teeth under the skin of an animal. And he didn't just use rabbits, he used all kinds of different animals. And what he found was not a thing happened to the animals because nothing happened around them. And this is a case of a tooth that was implanted under the skin of an animal, and you can see there was no changes in this tissue around here. It looked all perfectly normal. He also took various other things like coins, pieces of glass, and so on that were sterile, and he implanted those under the skin of an animal, and nothing happened to the animals from those. And so this showed that it was the infection in the tooth that was the problem that was causing these difficulties for patients. Well, this has become so strong because what we now know is that every root canal filled tooth still has infection in it, which is being released into the patient's body 24 hours a day, day after day, week after week, year after year. And eventually, even if they've got a good immune system to start, eventually they come down with a degenerative disease. Now, Dr. Rosenau did, by 1915, had discovered some research, a lot of research as a matter of fact, in which he was able to demonstrate 137 different degenerative diseases that were traceable to infections coming from teeth, and teeth of jaws or infections in the mouth. In other words, oral infections. And so it's imperative that everybody realize, particularly people working with people who have root canal filled teeth, that those patients may be suffering from a wide variety of diseases unbeknownst to them that are related to the fact that they have a root canal. And so then the question is, how is that so? And the reason for that is that getting into the anatomy of a tooth. Hand me that. Thank you. The anatomy of a tooth means its structure. And if we look at the tooth, everybody knows that the enamel is the hard outer covering of the tooth. And not too many know that the root has a hard calcium covering, which is called cementum. But all of the rest of that tooth, what you see here, is called dentin. And that dentin is almost as hard as enamel. And yet, strangely enough, it is not a solid material, but is made up of little tiny tubules. Those tubules are so small that if you took your smallest front tooth, which would be equivalent to about half of that, and took each tubule out and attached it end to end and stretched it as far as it would go, that those tubules would go for a distance of 3 miles. It's hard to imagine you can have that kind of tubules inside a tooth. But what's the importance of the tubules is that they contain a fluid. And that fluid that they contains nutriments. Now those nutriments come from the artery that comes into the tooth. Now I didn't mention, but the inside of the tooth has a root canal and a pulp chamber here. And that in that root canal, everybody knows there's a nerve, but not too many people know there's also an artery and a vein and other tissue as well. These tubules, as we stated, contain a fluid, and that fluid comes from the nutriments, and this fluid contains nutriments which come from the artery that comes inside the center of the tooth, the root canal of the tooth. And the artery drops off nutriments in those tubules the same as it drops off nutriments to every cell of the body, all through the body. Now, it's those nutriments in those tubules and the fluid movement in them that travels to all parts of the tooth. And in traveling to all parts of the tooth, that is what keeps teeth alive and healthy. Now, this is a very important facet because in actuality, when a tooth becomes infected, I guess, yeah, we'll use this one. You see that? Okay. When a tooth becomes infected by decay, it always starts out with a little cavity, and eventually it gets to be a bigger and bigger cavity. Once the decay, which is caused partly by bacteria, it gets into this root canal and travels down the root canal, those bacteria that are involved spy the dentin tubules, which come start right at the edge of that root canal, and of course they find that a delightful place to live. And besides, it's got all these luscious nutrients in there to live on. And so the bacteria then cause an infection in there, which eventually causes an abscess at the end of the root of the tooth. These don't always show up in every case, even though the tooth is infected. It can look perfectly normal and still be infected as badly as this, but not be visible. Dr. Price now did lots of research in numbers of different ways, and what he did, he made some cross-section cuts of teeth in which he photographed them under the best microscope that was available to him at that time, and that was during World War I days, and this was the photograph that he got. Well, when you look here, this was the high-power photograph under the microscope, and you see the decay breaking into the dentin tubules here and traveling down it, but that wasn't very clear to anything, so he did a high magnification study, and under high magnification here are the tubules that you see right here, and when you look very closely, you see those little black dots. Well, those little black dots are the bacteria or microbes that are inside the tubules. This was the first time anybody ever showed a picture of what was going on inside the structure of a tooth. And Price's picture was eventually pictured in his two books in which he documented his 25 years of root canal study research, and this was the first time that appeared. Now let me show you now a modern electronic view. This is increased in size by 1,210 times, much higher than the average microscope could do. And here you see the tubules cut in cross section, and you see that's quite a good sized hole when you see them increased in size by 1,200 times. And so that gives you a good chance to see what a tubule really looks like when it's enlarged. But here you see the tubules are not all lined up like you saw in that original picture on the tooth, because that's the way the artist pictured the tubules would be, and he didn't know that actually they intermingle with one another just the same as you see it here. Now it's that intermingling with one another that gives the dentin structure of the tooth its hardness. It's hard to imagine that even though those are tubules that contain fluid, that this substance, when a dentist cuts on a tooth, through the enamel, once he gets through the enamel and into this dentin, it sounds just like he's cutting on a hard stone. And yet, it's hard for people to picture. You can have these two things, a tubule with fluid in it, and still have that structure so hard that would be so. At any rate, this is why these infections are so dangerous. Now, it's often said that these bacteria that are in these tubules are locked in the tubules, but really they aren't locked in there, because every tooth has lateral accessory canals in them. And these are additional root canals, small ones, that do not show up on x-ray pictures, but every dentist knows that most teeth have several of these accessory canals. Now, any of these tubules that are in the neighborhood of those accessory canals, the bacteria that are here could escape into those accessory canals. Well, the accessory canals end up being going into the outer covering of the root of the tooth, which is the cementum, and just before the cementum into the periodontal membrane. That is a hard fibrous tissue which holds the tooth in the socket. It attaches to the root of the tooth and it attaches to the jawbone. And it's a very tough fibrous tissue, but it has a good blood supply. And so, of course, as the bacteria get into that tissue with a good blood supply, it infects it just the same as it's infected the tooth. And so that happens. And from there, it's just an easy going into the jawbone that surrounds, that holds the tooth in the socket. And that jawbone has a blood supply, and that blood supply now becomes infected as well. And so these bacteria now are traveling all over the body, searching for another place to live. And what they usually do is they find some place that's already been injured or diseased before, but they can start with any tissue that they happen to like and set up a whole new infection. And as an outgrowth of that, as we mentioned, Rosenau found there was over 137 degenerative diseases like heart disease, kidney trouble, bone problems, brain problems, all kinds of diseases have been traced to teeth. And so here we have one of the causes for the most number of illnesses that have ever been discovered happen to be coming from infections that are present in teeth and jaws. And so that's what this is all about today, and this is why we're getting to you an introduction of what is happening in the mouth and why it's so important to people's health that they eliminate any dental infections of any kind.
Okay.
We're going to repeat again because it's hard to think through to us that root canal teeth always remain infected, no matter how good they look or how good they feel. And so we want to bring that out in order to emphasize that this happened with other things other than arthritis. And here we see some cases of infections of different tissues. In this case, there was an infected tooth here, and there was actually 2 or 3 others in this patient's mouth. And this patient had an infected heart, myocarditis, as a matter of fact. And what happened is that when these extracted infected teeth were implanted under the skin of an animal, the animal got this infection of the heart, that the same infection that the patient doctors had found that she had had. And so that covered some of the heart cases that happened, and there were all kinds of different ones. And here we have a bladder infection, and bladder infections are rather frequent in many people, and not too many connect them with the fact that they've got a root canal filled tooth or an infection in their mouth. And in this case, there was a perforation of the bladder at this point, and that is why that picture is shown. Now this is another bladder case, an entirely different one, that showed up in another animal from a tooth that had come from a patient who'd had a bladder infection. And this one, you can see how vastly enlarged are the cells of the bladder from that infection. And so you're getting a chance to see that these infections involve all kinds of different disease entities for people. There's one disease that we haven't mentioned, and that is cancer. Not too many people get cancers in the mouth, but a fair number do. And one of the key people of this was Dr. Joseph Issels, who had his own cancer hospital in Germany for 30 years, in which he treated terminal cancer cases. And he had 2 things that he insisted on with every cancer patient, and that is that they had no infections in their mouths, or they had no toxic materials like mercury or other things there, because if they did have, he couldn't get cures and he had the best cure rate for cancer of any physician in any hospital in the state of, in the country of Germany. Now actually, here are 3 different cases of cancer of the mouth. This one is around this tooth. This is a large infected area. It looks like a typical abscess infection around the tooth, but this one happens to be malignant. And so does the area around these 3 teeth here that also turned out to be cancerous. And this is a wisdom tooth area where the tooth had been extracted sometime previous, and that became cancerous. Well, it's important that people know that this can happen, and dentists that are doing these extractions now do biopsies and have them tested by a noted doctor in finding out what kind of bacteria or microbes are involved and whether there are malignancies involved. And this sign says, "There's nothing so powerful as the truth, and often nothing so strange." And that was a statement by Daniel Webster many, many years ago, and it certainly applies to these dental infections. Next, I would like to mention some things about what are called cavitations. A cavitation is an infection in the jawbone. To explain it, if you have a cavity in a tooth, you know that that's a hole in the tooth. Well, a cavitation in the jawbone is a hole in the jawbone. It's just called a cavitation instead of a cavity, but because it's a slightly different type of thing than having happened in the tooth. Now here's a very large cavitation that has occurred in the wisdom tooth area, and this is where the wisdom tooth was, and you here see this large dark black hole that's full of dead bone cells. Well, it actually extends clear out to here, clear out to here. These are all dead bone cells spreading around. Now we have found by research that of all the people who have had their wisdom teeth removed, for instance, 94% of them still have infections present in their jawbone that are similar to this. Now they may not be this big or this extensive as yet, but they are present. In order to see these by X-ray pictures, we need what is called a Panorex X-ray to see them, and they are not easy to see in the beginning. They are not as easy as seeing infections at the end of the root of a tooth. And so cavitations are very profound, and they are present almost anywhere where people have previously had a tooth extraction, but they can be present for other reasons as well. And this is another form of infection in the mouth which can be contributing to degenerative diseases of the patient, as well as those that come from teeth themselves or from tonsils or other forms of infection in the jaws. Now, I think this has given you a rather hurried background of what this subject is about. I, of course, suggest that people read my book, Root Canal Cover-Up, because I covered most of these things and the research involved in them in that book. And I did that in order to get not only the lay public acquainted with these things, but physicians and dentists as well, because most physicians and dentists know nothing about what we're talking about here today.
Thank you very much, Dr. Meinig. I appreciate your time, and I hope that as a result, this will help many people overcome many of their health problems in life.
Thank you for inviting me to say a few words to you today.
Thank you, Dr. Meinig.